The Oxford-AstraZeneca COVID-19 vaccine is no second-class vaccine. The assurance from WHO PAHO Country Representative Dr. Erica Wheeler. Speaking at the ministry's virtual media conference today, Dr. Wheeler responded to questions about the efficacy of the vaccine due to be delivered to Trinidad and Tobago next month. Mahalia Joseph-Wharton has more.
PAHO WHO Country Representative Dr. Erica Wheeler said the Astra-Zeneca vaccine, the vaccine Trinidad and Tobago will receive under the COVAX facility, has been approved by international bodies like the European Medicines Agency.
WHO has a global responsibility to approve the quality, safety, and efficacy of all vaccines that are released for the public. So we are talking about 194 member states. The technical reviews, both of PAHO at the regional level as well as at the international level, are based on science.
Minister of Health Terence Dialsing reminded that healthcare workers, the elderly, especially those in long-stay homes and essential workers, are some of the groups that are first in line for the vaccine. He said consent forms would be given to the relatives of those in long-stay homes.
The most vulnerable, the most exposed will get a first shot, a first tranche, a first bite at that vaccination cherry. After we have done that, depending on the number of vaccines left from that first tranche, or if we get more, then we start what we call our mass vaccination program.
The vaccine will be delivered to Trinidad and Tobago by March 2021. Trinidad and Tobago has been allocated an initial 100,000 to 120,000 doses. The vaccine will be distributed through the public health system. The minister added that persons under 18 will not be vaccinated in this first phase. Mahalia Joseph-Wharton, TTT News.
Former Minister of Health Dr. Emmanuel Hussein is using his journey with polio to encourage citizens to take the COVID-19 vaccine once it arrives. During the Ministry of Health's virtual media briefing, he shared his experiences after he contracted polio at the age of 8. He did not receive the vaccine and underwent a series of procedures to save his life.
I went into a coma. I spent 2 weeks in a coma, a month in the iron lung, which interestingly enough was in San Fernando Hospital at the time. They had to bring the iron lung on a truck from San Fernando for just me, because I was the only one who would stop breathing. And I remained in the iron lung for over a month.
He said after that, he spent the next 6 months in isolation, totally paralyzed. When he was able to move again and breathe on his own, he would spend another year of his life at the Princess Elizabeth Home.
At which time I had my first operation, which required the transfer of muscles from my hamstrings to my the quadriceps. Then I came out. I then had to go back to school. My mother insisted I go to school right away. Then had to have another of operations, over the years.
Dr. Hussein said all of this was as a result of polio, a viral infection that could have been prevented had he taken the vaccine. He said the introduction of the polio vaccine saved many from going through similar experiences. The Ministry of Health has reported 2 new cases of COVID-19 in Trinidad and Tobago. The ministry says of the 2 new positive cases, none are recently repatriated persons. The number of positive cases reported reflects the samples taken during the period 29th to 31st January and not the last 24 hours. There are 254 active positive cases of COVID-19.